Hello friends, today we are going to discuss about attention deficit hyperactivity disorder. In short, it is also called as ADHD. I'm Dr. Suresh Bharat, Professor of Psychiatry working at NIMANS, Bangalore. In this video, I'll be introducing about ADHD, how to diagnose ADHD, what is the prevalence of attention deficit hyperactivity disorder, comorbidity, and neurobiology of attention deficit hyperactivity disorder. ADHD is one of the most common neurodevelopmental disorder of childhood. It was first described in 1775 by a German physician called as Dr. Adam. In his textbook, he described about the hallmark of ADHD, but however, it was not called as ADHD at the time. Later, in the early part of 20th century, Dr. George Still also described about the symptoms of ADHD, but however, he named it as the defective moral control. That was the word he used in his book. However, please remember, ADHD has been called by various terms by various scientists, physicians, and also the authors of various books. It is also called as hyperkinetic reaction of childhood or adolescence, hyperactivity disorder, attention deficit disorder, and at present, attention deficit hyperactivity disorder. Just because a child has hyperactivity or increased activity does not mean the child is suffering from ADHD. To diagnose ADHD, there should be presence of symptoms in varying frequencies, persistence, over a period of long duration, impairing various functioning ability, maybe school, maybe at home, and even in the society. And the pattern of symptoms should be present consistently over a period of time. Then only the diagnosis of ADHD can be considered. It is usually diagnosed in the childhood, that is, before 12 years old. And invariably, currently, the scientific literature is pouring with regard to adult ADHD. That means the childhood ADHD, children will not grow out of this ADHD. They require intervention. If you don't intervene, invariably, majority of them will have some residual effect in adulthood. That is adult ADHD. And this ADHD affects almost all domains of life. Paying attention, concentration, controlling impulses, hyperactivity, and emotional dysregulation. Although, if you look at the literature either focuses on hyperactivity and impulsivity or inattention. The literature with regard to dysregulation is very less. Unfortunately, ADHD people have emotional dysregulation as one of the symptoms, and invariably majority of the time cognitive behavioral therapy do not address this emotional dysregulation. Let's look into the diagnosis of ADHD as per DSM-5. That means whether my child is suffering from ADHD or not, whether the patient presenting in front of you has ADHD or not, how to diagnose this. Let's look into the DSM-5 criteria. The DSM-5 criteria is very clear. The symptom should be present more than 6 months. And these symptoms should be present before the age of 12 years. And these symptoms should be there either 2 or more settings. What does it mean? It should be at home and also at school or any other settings. It may be in the social situation, maybe in various other settings. And these symptoms should have negatively impacted education, social functioning, occupational functioning, and also relationship. And invariably, there are criteria have been placed. If the child is below 17 years of age, the number of symptoms is required as 6. Whereas if the child is more than 17 years, 5 symptoms or more is required for diagnosing of adult ADHD. Let's look into this ADHD symptoms. As I mentioned, these criteria has 2 important domains. One is inattention domain, which has 9 symptoms, and hyperactivity and impulsivity also has 9 symptoms. For diagnosis of ADHD in childhood and adolescents, the number of symptoms required is 6 in both the domains. For combined, and invariably 6 is required for inattention or hyperactivity domain exclusively. Whereas please remember, if a child or adolescent is more than 17 years, the number of symptoms required is only 5. So let's look into each one of the domain. The first, inattention domain. What are those 9 symptoms? First and the foremost, fails to give close attention to details or makes careless mistakes in schoolwork, has trouble holding attention on tasks or play activities, does not seems to listen when spoken to directly, does not follow through on instruction, and fail to finish schoolwork, chorus, and other duties in the workplace. Fifth one is has trouble organizing tasks and activities, avoids, dislikes, or is reluctant to do tasks that requires mental effort over a long period of time, losing things which is necessary for tasks and activities of daily living, easily distracted and forgetful in daily activities. Out of these 9 symptoms, 6 is required for a diagnosis of ADHD in child, especially inattentive type. Let's look into the hyperactive and impulsive domain. Again, here 9 symptoms are there, require 6 only. The symptoms are fidgetiness with or taps hands or feet or squirms in seats. That means the child is continuously fidgeting, leaves seat in situation and remaining seated is expected. The child finds it very difficult to sit in the classroom. The child moves constantly, runs about, climbs in situation where it is not appropriate. Adolescent and adults may be limited of feeling restlessness can be seen because of the maturity of the brain. I'll be discussing about that shortly. Unable to play or take part in leisure activities quietly. Even in indoor activities, they will not be able to follow the rules and regulation of the game. They become highly impulsive and they do not complete the game. On the go acting as like driven by a motor, that means they'll be constantly moving, talks excessively, blurts out answers before a question is completed, has trouble waiting their turn, interrupts or intrudes on others. So these are the various symptoms which have been mentioned about hyperactivity and impulsivity. So as I mentioned earlier, there are 3 important domains. One is predominantly inattentive type, another one is predominantly hyperactive impulsive type, combined presentation. And again, if you look at the subtyping has been done with regard to mild, moderate, severe based upon how much it is dysfunctional for the child. Let's look into the prevalence. How common is this ADHD in children? There are various studies done across various nations. Let's look into the meta-analysis of Chinese studies. There were 67 studies covering 6,42,266 Chinese children. The meta-analysis concluded the prevalence of ADHD was 6.3%. Now, let's look into the Indian studies. There were 14 studies of meta-analysis was done and the ADHD was 7.1%. Similarly, one more meta-analysis done in African countries. A total of 12 studies included in the meta-analysis and again ADHD was 7.4%. My dear friends, that means it is very common illness in children. If we look into the adult, based on pooled estimates from 20 studies of meta-analysis, adult ADHD was 2 to 2.5% of the adults were suffering from ADHD. Invariably, it is inattentive type. To summarize, my dear friends, if you look at all the studies, maybe studies from various countries, meta-analysis, it clearly indicates 5 to 7% of children are suffering from ADHD, 2 to 2.5% of the adults are suffering from ADHD. So, the prevalence is very common. It is almost like a epidemic proportion. Let's look into the impact of ADHD. What will happen if you don't treat ADHD? What are the consequences of not treating ADHD in children? First and the foremost, the children will have difficulty in learning. They will fail in exams. They will not be able to move forward. They will start hating education. They will become angry with the education system. They will start abusing the teachers, family members, whoever tell them to study. Slowly over a period of time, they will develop oppositional defiant disorder. They will become angry whenever somebody talks about education, somebody talks about passing the exam, somebody excelling in the exam. So invariably ODD symptoms becomes pronounced. Over a period of time, the whole society looks at these children are menace, good for nothing, not educated. Invariably, the children will be hated by the society, and these children will start breaking law and develop conduct disorder, and over a period of time, antisocial personality disorder. Various other personality disorders are likely to develop, and these children who are very, very restless, impulsive, invariably meet with various road traffic accidents. And very commonly, if you look at the emergency, the children who reach emergency departments are invariably ADHD patients. As they become adolescents, sexually transmitted diseases are very common in them because of impulsivity, because of emotional dysregulation. They will have multiple contacts with various people, and especially they may also may have teen pregnancy or early pregnancy is very common. And over a period of time, to overcome this dysphoria, they will start using substances. Invariably, they end up taking multiple substances. It may be tobacco, cannabis, alcohol, cocaine, morphine. So the drug abuse becomes very common. And over a period of time, they will get in conflict with law. They will be arrested. And recidivism is very high, especially in ADHD and personality disorder, children or adults. And please remember, my dear friends, ADHD creates a serious impact, and this causes the children to drop out from school or colleges and has a severe impact on the economy of the family, community, and the nation at large. And invariably, these children will be in conflict with law, and the society and the family members starts hating these kids. And remember, ADHD is a lifetime diagnosis. That means they become disabled within the society, and many a time the society has to deal them if we don't deal them during the early part of their childhood. Let's look into the comorbidity, whether ADHD comes alone or it comes with other psychiatric illness or physical illness. The studies have clearly indicated comorbidity is the rule in ADHD. Autism spectrum disorder is up to 60%, learning disorder 70%, tic disorder 55%, depressive disorder 15 to 50%, bipolar disorder 5 to 47%, anxiety disorder 15 to 35%, conduct disorder up to 10%, ODD up to 50%. That means, my dear friends, invariably, if you see a ADHD patient, look for comorbidity, because invariably you try to treat ADHD, the comorbidity will create problem over a period of time, or else they may become dropout because they do not find any solace or improvement in their symptoms if you don't address comorbidity condition. As I mentioned, please remember, comorbidity is the rule in ADHD, and invariably ADHD presenting as a sole diagnosis or a single diagnosis is hardly in 30 to 35%. That means remaining 70% of the patients will have one or the other comorbidity. So please look for comorbidity when you are treating for ADHD patients. Let's look into the neurobiology of attention deficit hyperactivity disorder. There are various hypotheses has been proposed, and some of them have been considered in various neuroimaging study, neuropsychological study, neurophysiological studies, and various other studies. If you look at the neurohormonal theory, it clearly says imbalance in epinephrine, norepinephrine, dopamine, and to some extent sertraline has been considered. Some of the neurocircuits dysfunction has been also been proved in various neuropsych experiments, or you can call it as trials. And various genetics studies have clearly implicated involvement of multiple genes. Cognitive dysfunction, especially poor control of impulses, working memory, poor planning and executing function, especially involvement of frontal lobe, has been clearly indicated. And also studies have clearly indicated about of involvement of multiple environmental stressors leading to ADHD. Let's look into the neurobiology and neurocircuits. The important areas which have been implicated in ADHD is frontal cortex to cerebellum, prefrontal cortex to basal ganglia to cerebellum. These are the various circuits which have been implicated in ADHD. Let's look into these various neurocircuits. First and the foremost, these circuits involving frontocerebellar network is the one which has been showed in this diagram. In the next important is reward network. Here you can see the involvement of nucleus accumbens and also other parts of the brain, both prefrontal and also limbic system. Moving to the frontostriatal network, which is also one of the important neurocircuit which has been implicated in ADHD. Executive function network, and finally, attentional network has been implicated in ADHD, my dear friends. Let's look into the neuroimaging studies. Imaging studies clearly said that structural changes have been noted in ventral striatum, caudate, putamen, and cerebellum. Some studies have reported decreased cortical thickness in these areas. Reduced activation in the prefrontal and striatal region has been shown in functional neuroimaging studies. And if you look at to summarize the whole, you can see ADHD has three important types: inattention type, predominantly impulsive and hyperactive type, and combined. Let's look into the basic process. One of the inattentive type has executive function and impulsivity, whereas hyperactivity and impulsive you can say motivation. And in executive function, if you look into this, working memory, behavioral inhibition, delayed aversion, and reinforcement involvement in motivation. If you look at the neural mechanism, you can see prefrontal cortex, basal ganglia, cerebellum involvement. And if you look at the neurohormones, noradrenaline, dopamine, and serotonin involvement has been found. And also, various genetic studies talked about various genes, and it is not a single gene, multiple genes play an important role in the development of ADHD. And again, my dear friends, the cause and risk factors for ADHD are unknown at this present. That means the current research shows genetics do play an important role, but which gene contributes to how much is very difficult to say. Genetic studies indicate there is a loading of mental illness in the families and monozygotic twins. The concordance rate, especially in the twins, is up to 60 to 80% in monozygotic twins. That means genetics play an important role in ADHD. The combination of genetic and environment play a crucial role in the development of ADHD and maintenance of symptoms. Environmental factors like childhood trauma, sexual abuse, single parenting, family discord, parental discord, and certain learned behavior play a crucial role in the development of ADHD and continuation of symptoms. But however, there are studies which clearly indicated there are some organic causes behind the ADHD. But however, these are very minority or minor percentage in the development of ADHD, such as exposure to environmental risk during pregnancy or young age, especially to lead. Again, further, exposure to alcohol, cocaine, tobacco in pregnancy, especially in mother, can cause ADHD in children. Brain injury or birth asphyxia, premature delivery, low birth weight, encephalitis and meningitis sequelae, sometimes seizures and drugs can cause ADHD. Hence, only the minority are involved, but however, it is important to rule out ADHD by taking a good past history and also looking into the medical history of the children. To summarize, my dear friends, about neurobiology, genetics and environment play a crucial role in ADHD. Family plays a crucial role in maintaining and worsening of symptoms. Family members' coping skills, feeling of guilt that we have a ADHD child, and the mother may feel because of me that there is ADHD child. Inconsistent rewarding, punishment play a crucial role in the development and maintenance of ADHD. Imaging studies have documented alteration in the brain structures and functional network, suggesting that ADHD involves both cortical dysfunction and also abnormal connectivity and subcortical structure also involvement. Combination of factors play an important role in ADHD, and however, Please remember, we need to rule out organic causes of ADHD. To conclude, my dear friends, ADHD at this point of time is a lifetime diagnosis. Earlier, although it was considered only childhood, now studies clearly says 2 to 2.5% of the adult continue to have ADHD. Most of the time, it is underdiagnosed, undertreated, and many a time these children are stigmatized. And please remember, ADHD can destroy child's future and also cause severe burden on the family. Early identification is and treatment is essential. Early treatment helps in academic development and also having a good relationship with the friends, and improves the self-esteem of the child, social functioning, temperamental and personality development in the long run. So my dear friends, if you find an ADHD child, please initiate treatment at the earliest by engaging the family members and the child for the treatment of ADHD. Please do tell them ADHD is a lifetime diagnosis and the child requires assistance even in the adulthood. Thank you very much for your valuable time. Stay safe.